Whether it's taking a selfie at an event or FaceTiming with a loved one, more than ever, we are taking a closer look at ourselves. The popularity of social media and apps that allow you to enhance your appearance are becoming the new normal and causing many to want to change the reflection they see in the camera lens. And very easily, they're able to nip, tuck, or inject even the slightest issue away. What started out as a fun way to change how you look with filters on Snapchat and Instagram has gone to a whole new level.
It's very tempting to take every single photo you take and smooth out your skin or, enhance your eyes or do something.
Ragone is a clinical nurse injector at Dr. Bucky's office for plastic surgery. Over the past 2 years, she's noticed more and more patients asking to look like their filtered face. She shows how easy it is to do on her own face with an app.
I could make my lips a little fuller. I can take my eyes and I can open them up and make them just a little wider, a little brighter.
At Dr. Bucky's office in the heart of Rittenhouse Square, non-surgical procedures such as Botox and fillers are up 25%. The increased emphasis on selfies.
The other thing that this whole selfie world has done is when we look at photos of ourselves straight on, it puts a little too much emphasis in the central face. And there are aspects to our appearance that are very important. Framing the periphery, temples, cheekbones, etc.
Do patients have unrealistic expectations of what's possible?
I think they do on some level, that it's easy to become unrealistic.
Allison likes how she looks, but after losing a little bit of weight, she wanted slight, natural changes to her appearance to restore volume to her cheeks.
Right now, you can see all the lines in my forehead. That is without Botox. So with Botox, you'll just have more of a smooth finish.
Before she's ever injected with a needle, 3D imaging shows what her face will look like with filler in her cheeks to create the appearance of higher cheekbones.
If you can enhance just a little bit, why not?
With a vibrating tool to distract from the needle, Botox is injected between Allison's brows.
And you're gonna just feel a slight injection above the eyebrow, a little pinch. Good job. Look at you. You did your first little injection.
Then to correct Allison's loss of volume in her face, the equivalent of a 1/4 teaspoon of Restylane Lift is injected in each cheek.
We're gonna go 1, 2, 3.
And seconds later, she's done.
Thank you.
2 weeks later, you can see the difference in Allison's face. Smile lines and frown lines in the forehead are gone, and her cheeks are more lifted.
So you can see that we just created this little subtle highlight here.
Dr. Bucky says all you need is a little to make a big impact. And just as important as the relationship you have with yourself is the unfiltered conversation you have with your doctor. And Dr. Bucky says the entire face must be taken into account from different angles, and what often looks good in pictures will not translate well in person. In Allison's case, many of her slight tweaks were preventative. As always, it is a case-by-case basis.